Hi everyone, my name is Dr. Roopa Prasad. I'm an obstetrician and gynecologist working at Saraogi Maternity and General Hospital and Iris IVF Center. Today I'm going to talk to you about fibroids. Fibroids are non-cancerous growths within the wall of the uterus. They are very commonly found in women between the ages of 20 and 50. Around 50 to 70% women of that age group have fibroids. Most fibroids are asymptomatic. In the sense, they don't produce any symptoms. However, some fibroids can cause women to have prolonged bleeding or very excessive bleeding and pain during the time of menses. Especially fibroids which are jutting into the uterine cavity or very large fibroids within the wall of the uterine cavity. These women may also have aches and pains off and on in their lower abdomen during the rest of the month. Some fibroids, based on their location, may cause difficulty while urinating or while passing stool. When the fibroids are very large, women can often feel a lump in their lower abdomen. Some fibroids notoriously make it difficult for women to get pregnant, especially if the fibroid is within the cavity. It takes up too much space within the cavity and too much of its blood supply, because of which it becomes difficult for the growing embryo to implant. Sometimes, if the growing embryo is implanted, a submucous fibroid may cause an early abortion. Small fibroids within the wall of the uterus or on the surface of the uterus do not cause any trouble to get pregnant. Even in pregnancy, these fibroids do not bother the pregnant lady much. However, if they are submucous fibroids jutting into the wall of the uterus, they may cause abortions in the first trimester. Fibroids are hormone-dependent tumors. So during pregnancy, they tend to enlarge as the days of pregnancy pass. In the second trimester, that is after the 4th month, fibroids are notorious for red degeneration. This is a condition where a growing fibroid outgrows its blood supply. It causes a lot of pain to the pregnant woman, for which she usually needs to be admitted, given hydration, antibiotics and painkillers. Large fibroids may also cause trouble at the time of delivery, causing excessive bleeding at the time of delivery and also bleeding prior to delivery, called antepartum hemorrhage. It may also cause a woman to deliver her baby preterm, that is, before 9 months of her pregnancy are complete. Let us now discuss how to treat these fibroids. If the fibroids are small and not causing any symptoms, they often do not need any treatment. We will just observe them to see if they are increasing in size over time. Women with small fibroids can easily get pregnant, and usually they cause no trouble during pregnancy. When fibroids cause excessive and prolonged bleeding, the first line of treatment is with medicines to bring down the bleeding and often contraceptive pills to regularize the period cycle. If a lady continues to bleed excessively despite these treatments, then she needs a surgical removal of the fibroid. If the fibroid is jutting into the uterine cavity, it can be removed using a hysteroscope by a process called hysteroscopic myomectomy. Most fibroids do not need any treatment, especially if they are asymptomatic. What we do is an ultrasound every year to monitor the size of the fibroids. Most women with small fibroids can become pregnant naturally. Fibroids that are small in size and are within the wall of the uterus do not cause much trouble during pregnancy. Fibroids which are causing excessive bleeding during the menstrual cycle need to be removed depending on their location. If the fibroid is jutting into the uterine cavity, it is removed using a procedure called hysteroscopic myomectomy. The lady is put under general anesthesia. A telescope is introduced into the uterine cavity. The fibroid is localized and cut using a resectoscope in small pieces, and it is shaved off the uterine wall. These pieces are then removed. Once the fibroid has come out of the uterine cavity, the symptoms of excessive and prolonged bleeding come under control. If there are large fibroids within the wall of the uterus, they need to be tackled from the abdomen. These fibroids can be removed by either making a cut on the abdomen or using laparoscopy by making multiple small incisions on the abdomen. The fibroid is present within a wall. A cut is made on the wall till the fibroid pops out. The fibroid in an open surgery is removed in one complete mass. In a laparoscopic surgery, this fibroid is shredded into small pieces and removed through a small hole. The rest of the uterus is sutured up. A woman can try for pregnancy 6 months after this surgery. Surgical methods are usually resorted to when medical methods fail to control bleeding or when infertility is the cause of trouble. A fibroid can rarely be cancerous. Out of 1,000 women with fibroids, there is only one woman who may develop cancer in her lifetime within the fibroid.